Hi there. I'm sure most of you by now know that pain management is a big deal everywhere. It doesn't matter where in the world you are. Pain management is a significant problem. In fact, in the United States alone, more than 100 million people are suffering from pain of some sort, whether it be chronic pain, acute pain, or just pain from illnesses that they don't even know what is going on. So on this channel, we're going to be talking about everything pain related. So call your neighbors, call your friend, maybe your enemies. Let them know that on this channel, we're talking about pain management. So this is now an information pain management channel. I'll be right back and we'll be talking about the introduction of pain medicine. Welcome back to our YouTube channel. My name is Dr. D. Terrence Foster. If this is the first time that you're joining us, let me just extend to you a very warm welcome to you. Wherever you are in the world today, it is indeed a pleasure to have you. And I also want to let you know that on this channel, we focus on simplifying medical issues for everyone, particularly those who may have felt left out. This is your channel. Consider subscribing. It is free, and we produce a new video every week. So let us begin to talk about pain. What is pain? And we'll also talk about pain management as well. Pain is an uncomfortable sensation or distressing feeling that usually signal an injury or illness caused by intense or damaging stimuli. Now, the International Association for the Study of Pain, the IASP, defines pain as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Generally, pain is also regarded as a symptom. It is the body's way of telling us something is wrong or that something is not right. The IASP also classified pain into two main categories. The first one is nociceptive pain. That is pain caused by non-neural tissue damage. This is due primarily to activation of nociceptor or pain receptors, not related to nerves or nerve tissues. Now, the symptoms from nociceptive pain will be sharp, achy, throbbing. It may be acute or chronic, but in most cases it tends to be acute. Often experienced in joint, muscle, skin, tendon, bones, so it's more related to, it's related to musculoskeletal in a lot of cases. And you may see it also related to cancer treatment related to radiation. That will also lead to tissue damage. Now, the next category of pain is neuropathic pain. This is pain caused by nerve damage from lesion or disease that affect the somatosensory nervous system. Now, this is not the entire nervous system in general. Now, a symptom can cause or may include shooting, tingling, stabbing, or burning pain. You may have some difficulty with pins and needle sensation or sensitivity to touch. These are all related to neuropathic pain. The pain may be intermittent, it may be acute or chronic, but generally they tend to progress to chronic pain. In some instances, for example, chemotherapy related to cancer may be a cause of neuropathic pain. Now, some examples of neuropathic pain may be a spinal nerve injury or radiculopathy, neck or low back pain problem, diabetic neuropathy, shingles or post-herpetic neuralgia, painful scars such as neuroma, trigeminal neuralgia, pain related to muscular sclerosis, phantom limb pain, where you've had a limb amputated and now you're having pain where the limb used to be. And of course, there are numerous other examples of neuropathic pain. Now, the other category that also is included in this classification, but is not considered a major category in general, is called functional disorder pain, or in general, other pain. Now, this has several different names, and these are pain without any identifiable cause or source. In other words, it's not neuropathic, it's not clearly tissue related. But these are pain that are there and they're just pretty non-specific in general. For example, this type of pain could be non-specific low back pain. Fibromyalgia is an example, or primary unexplained headaches. Another example of this group is complex regional pain syndrome, CRPS. It's also referred to as reflex sympathetic dystrophy, RSD, also known as causalgia, or sympathetic mediated pain, all the same name for the same thing. You may also in this class is irritable bowel syndrome. Now, these are pain, as I've said, that have generally no specific identifiable cause. In the case of sympathetic dystrophy, there is also some quote-unquote established cause for this, but still considered to be of unknown cause in general. Another category of pain that you often will hear about is called inflammatory pain, which is due to an abnormal inflammatory response or cause from immune mediated response that are abnormal. For example, you may see this in gout arthritis or rheumatoid arthritis. But you could also see this and have it reclassified. So it's not everything doesn't always fit in the same category. There are a lot of overlaps in these categories, but there are different names that are given to different pain-related symptoms or syndromes. Another example that you will see is psychogenic pain. This is pain that is affected by psychological factors. That could be anxiety, depression, fear, or other psychiatric-related problems. Now, these are pain that are generally prolonged by these illnesses. And in a lot of cases, there's tissue-related damage, or there may be neurological or nerve-related damage. So that's also, you also see that as another type of pain. Another type of pain that you will see is called somatic pain. This is a type of nociceptive pain experienced in skin, muscles, bone, joints, and deep tissues. It can be localized fairly accurately by the brain. And coordination is good and allows us to adjust our activity when we're experiencing somatic pain. Now, there is also what is called visceral pain. And visceral pain is a type of nociceptive pain as well. But these arise from internal organ in the thoracic and abdominal cavity. They tend to be more diffuse, more difficult to isolate and pinpoint exactly where they're located. In general, you may say one may have, for example, an abdominal pain or chest pain or something of that nature. But it's generally much more difficult to localize compared to a somatic pain, which means that it's often difficult for the brain to localize the pain. Now, another general category you may see fast and slow pain. And these are just referred to the nerve fiber that is conducting the stimuli. There are fibers that are called AVE-type fibers, and these carry acute pain. And then there are fibers that are called C fibers, and these carry more slow pain or slow stimulus. And these are more associated with chronic pain. So you'll see all these different type of categories for pain. Slow fibers and fast, or slow pain and fast pain. Now as you can see, there's so many different categories of pain, and we're not done yet. You may also see broad categories like acute and chronic pain. Acute pain is pain that is generally less than 6 months, and chronic pain is pain that is more than 6 months in duration. Now, these pain in acute could be soft tissue injury, could be serious injury, could be any type of injury, but generally lasts for less than 6 months. Chronic pain, on the other hand, much longer duration. It may be intermittent, it may be sharp, sometimes it may be significantly elevated, or it may be a low or dull pain. Chronic pain tend to be more constant or intermittent. Example, headache, for example, may be a chronic headache, or it may continue for many months or years, or it may be present once in a while. Also, certain health conditions may manifest themselves as chronic pain. For example, diabetic neuropathy is an example of that. Some pain are also classified as syndrome. For example, fibromyalgia is considered myofascial pain syndrome, which is comprised of many different pain areas involved in the bodies, and also associated with other sort of neurological or psychiatric illness in some instances. Now, another type of pain syndrome that you may have heard about is central pain syndrome. This is a syndrome that is marked by chronic pain that stems from damage to the central nervous system. Now, these damage may cause by, for example, a tumor, a stroke, or other illnesses that affect the central nervous system. Now, the pain may be the pain generally may be constant, it may be severe, or it may have varying level of degree of severity. Now, it may affect certain part of the body. It may affect the hand or the feet. For example, if you have a stroke, it may affect one side of the body and not the other side. And you may realize that certain factors like temperature may affect the intensity or the level of pain that you're experiencing at any given time. Another term that you may be familiar with or have heard about is breakthrough pain. What is this? This is fairly simple in the context of everything. It's pain when you're on pain medication, then you're still experiencing pain in spite of taking the medication that you're on, probably because the medication is inadequate, or you're running out of medication, or you develop a level of tolerance, or for so many different reasons. You could have breakthrough pain. Now, that's one type of pain that is also out there. Now, another type of pain that you may have heard about is radicular pain. These are pain that result from compression or inflammation of the nerves from the spinal cord into our extremities, into our arms or legs, or wherever. These nerves get compressed. Now, when this happens, you may have some numbness, tingling, or burning sensation. You may have some weakness in some instances, depending on the level of severity of the pain. In some instances, in severe cases, it may develop into what is called a radiculopathy. And these are some of the things that we will discuss in future videos. Now, the next one, and this is the big one, it's called cancer pain. And this is pain that has developed as a result of the presence of cancer. Now, this may be chronic, it may be acute, but there are many different causes related to the pain. Sometimes it's related to the spread of the cancer, it may be related to the progression of the cancer, because sometimes the cancer may spread very rapidly. And in doing so, it affects the internal structure of the body, and depending on the organ system or the tissue which is being invaded. So you'll have different pain. You'll have pretty much the possibility of all different type of pain is possible from having cancer. And the treatment of it is often very complex and very difficult. A lot of time, opioids is the mainstay of this type of pain. And one of the challenges that patients will from time to time need increasing dose of opioids to address the increasing pain level that they're experiencing, or the increasing intensity of pain that they're experiencing. Sometimes tolerance or dependence may develop, and additional treatment option has to be looked at, such as a pain pump, or maybe some interventional procedures may be appropriate, or joint injection, or epidurals, or depending, of course, on the patient, their condition, the type of cancer. All these are things that would have to be considered in the totality of the patient's treatment. Some of these patients will need palliative care, and in some instances, the patient may be terminally ill, and therefore the treatment would be customized according to life expectancy and the patient wishes and their family wishes. These are things that also would have to be worked out according to their physician and family, and all these things would have to be discussed to facilitate the appropriate care and management of patients who are living with cancer. So a lot of different pain syndrome, different pain type, and this is in part why pain management is a very complex field of endeavors, and why a level of expertise is required in order to treat patients appropriately. Which brings me to the question, what is pain medicine, or what is pain management as a discipline? Now, Now, the American Academy of Pain Medicine described the specialty of pain medicine as follows. The specialty of pain medicine is concerned with the study of pain, prevention of pain, and the evaluation, treatment, and rehabilitation of persons in pain. So we're looking at the study of pain, the prevention of pain, the evaluation and treatment, as well as the rehabilitation of pain. So who gets to do this? And that's where your pain management consultant or your pain management doctor comes into play. Now, based on what we've done so far, you could see that pain management or the management of pain or pain medicine is a very complex subspecialty. So who is a pain doctor? And what would we expect a pain doctor to treat? We would expect to see conditions such as sports injury, herniated discs, joint pain, arthritis, hip and knee pain or injury, chronic or acute migraine or headache, compression or pinched nerve, chronic fatigue syndrome, fibromyalgia, injury related from strain or muscle sprain, or post-surgical pain, for example. Maybe injury related to an accident involving a motor vehicle accident, slip and fall, diabetes. The list goes on and on. So there's a range of diagnoses and conditions that are treated by pain specialists. So let's look and see who is a pain doctor. So who is a pain medicine doctor? Pain management or pain medicine doctor, sometimes referred to as an interventional pain doctor, or medical providers or doctors who, for the most part, are board certified or board eligible, or they are appropriately credentialed in the discipline or specialty of pain medicine to manage and treat patients with pain. They may have had their primary board certification in physical medicine and rehabilitation, anesthesiology, neurology, psychiatry, and to a lesser degree, radiology. Now, after they've finished their board certification in those areas, then they may have another board certification in pain management or interventional pain medicine or pain management. A few other significant specialties also have providers with pain management board certification. These providers take a comprehensive approach in general to management of pain by utilizing and collaborating with other services and disciplines. These include, but not limited to, for example, physical therapy, occupational therapy, massage therapy, chiropractic care. It could be cognitive behavioral care, biofeedback, interventional pain procedures, and a host of other things that are at the arsenal or the tools that pain management consultant or pain provider have to offer to their pain population. So there's a close working relation with other specialties and other consultant. It is not just pain management by themselves, but we're working closely with almost every specialty that is in the medical profession. In general, in most instances, a multidisciplinary approach is taken in dealing with some of the more complex issues of pain and pain-related cases, particularly when it comes to chronic opioids or rehabilitation issues and pain-related condition that has to be addressed, not just from a single dimension, but at least, as I said, a multi-dimension or a multidisciplinary approach has to be taken in order to facilitate adequate and effective treatment of each patient. Now, one of the other questions that you may be asking, well, who is not a pain doctor? Now, all doctors in general are given a license to practice medicine and surgery, for example, and it means that anyone in theory could do surgery because they're licensed to practice medicine and surgery. But of course, not all doctors do surgery. Similarly, in the case of pain medicine, the DEA will license or grant a license to most doctors to write narcotics. So almost all doctors with appropriate credential by the DEA will be able to write narcotic prescription. Now, it doesn't mean that all doctors will do that, or not all doctors will, of course, write the same level of narcotics that for example, that is seen in a pain practice. But at least they have the authorities to do that and to do that legally. Now, this means that anyone, a family practitioner or internal medicine doctor, a pediatrician or a podiatrist, endocrinologist, infectious disease doctor, a pulmonologist, whoever it is, a dentist, they could all write narcotics. Now, what that means is that in terms of what is called pain medicine, which for some people it's the prescription of narcotics, which is not what it is, then it means that almost anyone could be a pain medicine doctor, but that is not the case. So what am I saying? I'm saying that because someone is able to write a prescription for you that is a narcotic, that doesn't mean that they are, or that person is a pain medicine doctor. It follows some of the things that I've discussed before. If you're not appropriately trained, yes, you could write those narcotics, but that doesn't make that provider a pain medicine doctor. It's very important to know that. One of the challenges or one of the problem of the opioid epidemic is the ability or the authority that just about so many doctors have to write narcotics. And therefore, anyone could set up a clinic and write as much narcotic as they want during the pill mill era. And that was in part one of the reasons for having the problem with opioid epidemic that we've had, which is still a significant problem right now in our country, or in the United States and in Canada and so many other places. So it's important to understand the difference between a pain medicine doctor or interventional pain medicine doctor and someone who is just writing prescription or has the ability to do that. And if you get to that point where you really need interventional pain management or pain consultant, then you need to make sure you find one or to ask your primary care doctor to refer you to one. Now, of course, most of the condition that I've shown, which I'll show again here, is that some of those things doesn't mean that they have to be treated initially by a pain doctor. Very often the pain doctor would see the patient much later on in their care, sometime too late, sometime much too later on in their care. But of course, they should be referred to a pain consultant to address some of those issues in a timely manner so that these issues do not become more complex and much more difficult to manage in general. So there, as you could see from this presentation so far, there's so many conditions and so many different treatment options are available that will treat each condition. So it takes someone who has a keen sense and understanding of how best to utilize these treatments and how best to make sure that their patient that they're seeing is getting the appropriate treatment. So make sure that you're aware of some of these conditions and some of these different type of pain that are out there, and know that not everyone that out there and says pain doctor is a pain doctor, and not everyone is going to be able to provide the level of care that is important. In treating patient with respect to pain, there's so many options that are available. Some of them are physical therapy, occupational therapy, hydrotherapy. The list goes on and on. Yoga, Pilates, Tai Chi. Of course, there's interventional pain procedures that are available for, you may have epidural, facet blocks, nerve blocks, spinal cord stimulator implantation. You may have a pain pump implanted. You may have a joint injections. You may have regenerative medicine. You may have trigger points, biofeedback, cognitive behavioral therapy. The range and the level of medicine and options that are out there for pain medicine is indeed huge and extensive. And some of those things we will be discussing in future lectures. So make sure that you tune in. I mean, there's Botox injection for treatment of migraine headache, for spasticity treatment. There is acupuncture. They're just, it's endless, literally endless. One of the things that I've done is to write one of the most comprehensive books on the opioid epidemic, which is this book. It's called The Opioid Epidemic. It is called The Opioid Epidemic, Consumers and Healthcare Guide. I'll put up a link in the description section regarding this book. But know that there are tons and tons of information and options out there. So that's why the specialty is so important and just so involved. So it's not for everyone, of course, but when you find a good pain management doctor, you're very fortunate indeed. Now, of course, not all of these treatment are ideal for everyone. Some patient will have some treatment, some may not be qualified for others. So each patient has to be evaluated, and depending on their needs, depending on their condition, depending on what they've been treated for, that will in part determine what type of treatment they will qualify for, or that they most likely will benefit from. In any event, not every treatment will be appropriate for everyone. So as you can see, the practice of pain medicine and pain management is indeed very, very complex. But I am going to take as many of you as possible on this journey of managing your pain. Along with, of course, your primary care doctor and your pain specialist. They will be the one taking care of you. I will be providing you with information so that you can enjoy your life and we'll all be safer. I encourage you all to like, share, and subscribe to this channel. Make sure you comment on it. Let us know what you want us to talk about. This is a very complex topic. There's so many things we could talk about. I'm board certified in pain medicine and board certified in physical medicine and rehabilitation. And you could check out some of my credentials below, so we could have a lot of fun with this. So make sure that you tune in. Make sure when you subscribe, you hit the notification bell so that each time we release a new video, you will be notified. And always, let us all remember, let us all strive to keep a healthy mind and body. Thank you so much for watching.